Hi everyone. Thank you for joining our webinar, How to Put Legislative District Data to Work for California Children. I'm Barbara Fader-Ostrov, Communications Officer for the Lucille Packard Foundation for Children's Health, and I'll be your moderator today. We made a significant upgrade to kidsdata.org late last year, and we're holding this webinar to help you navigate our new features and new ways to use our site. In particular, we'll be focusing on how to access data available by legislative district and use our legislative mapping feature. We'll be recording this webinar, and it will be archived on kidsdata.org. Let me introduce our presenter, Reagan Faust. Reagan is Data Manager for Programs and Partnerships at our foundation. She oversees all the data on kidsdata.org and has helped turn it into the great resource it is today. She holds a PhD in educational psychology. For now, you all are in listen-only mode. There will be ample time to ask questions at the end of Reagan's presentation. And we'll have questions. You can type your questions into the question box that you'll see on your control panel. With that, let's get started. Reagan?
Hi everyone. I'm excited to be here today. I want you to get the most out of this free resource, and this webinar is designed to do just that. So it will include a brief introduction to our foundation and kidsdata.org, a tour of the site, and a demonstration of how you can use it for your purposes. Today we'll explore data by legislative district and use the legislative district overlay for data not cut by legislative district. Because we're going to focus on legislative data today, I'm going to enter kidsdata.org through the Data by Region section, which may be new to even the most seasoned kids data users, so I hope that everyone will learn something new. Let's begin. The Lucille Packard Foundation for Children's Health is a foundation that's dedicated to elevating the priority of children's health in California. Kids Data is our tool to achieve this. The goal is to promote the health and well-being of children in California by providing an easy-to-use resource that offers high-quality, wide-ranging, and local data to those who work on behalf of children. The site provides more than 500 indicators of child health and well-being in all counties of California, and when possible, data are provided at the city, school district, legislative district, and national level. Data largely come from well-established public sources, such as the U.S. Census Bureau, Department of Education, Department of Public Health, but we also have partnerships with organizations to liberate proprietary data sets. And the data are continually updated. So in creating the site, we had 4 key goals in mind. We wanted to make the data easy to find, digest, use, and share so that you can improve kids' lives. So what data are available? As I mentioned, we have over 500 indicators, and 24 are cut by the new legislative district boundaries that are based on the 2010 census. So these are the most recent legislative boundaries. Although the rest are not cut by legislative district, you're able to overlay on any map with the most current legislative boundaries, so you can get a sense of the situation in that district. And I'll show you how to do this in the last half of the demonstration. So here's a list of all of the indicators cut by legislative district, and it's on our blog, Data Points. So as we scroll down, you can see that the indicators span 10 topics, and these include demographics, demographics of children with special health care needs, family structure, immigrants, early education and child care, disconnected youth, family income and poverty, housing affordability, unemployment, and health care. At the end of this webinar, I'll send you a link to this blog post for easy access to all of the indicators cut by legislative district. So how do we access these data? The data on kidsdata.org are organized in 3 ways: by topic, by region, and by demographic group. So your entry point really depends on what you're looking for. For example, if you're interested in a topic like immunizations, you would go straight to the aptly named Data by Topic section. Since we're interested in legislative district data today, we're going to enter through the Data by Region section. In order to enter the site, you can also search using the search bar for your region. You can also use the tabs here. So clicking on the tab will take you to a list of all the regions for which we have data available on kidsdata.org. And the regions are nested, so clicking on the plus sign is going to reveal smaller and smaller regions. We're interested in legislative district information today, so I thought as an example I would dive into a local district, someone that's close to home, Assembly District 25. It covers parts of Santa Clara and Alameda counties, and Assemblyman Bob Wachowski represents this district. So clicking on that link will take me to all of the data we have for this district. So to the left are the categories for which data are available, and then to the right are key indicators for each category to help you digest what's available, snapshots. For example, here are just a few key indicators in the demographics category, customized to show just the data for the district and for the state of California for context. You might notice that all of these data have the same year range, 2008 to 2012, and that's because all of these come from the U.S. Census Bureau's American Community Survey, and they are all 5-year estimates. You'll also notice that there is only one time period available. The data for previous time periods were cut using the old legislative district boundaries, and so we provide only the most recent one. And please note that we also provide all of these indicators cut by county, city, and school district, and provide the 5, 3, and 1-year estimates for those. So I'll show you how to find those data later. Here's what another category summary page looks like. Now remember, this is a snapshot. If we wanted to see all of the data for this category, you can just click See All, and this takes you to a list of all of the data that we have for this category. In this case, there's only one indicator in this category that's cut by legislative district, and it's children ages 3 through 5 not enrolled in preschool or kindergarten. As it's coming up, you could also expand other categories to see the data that are within those. Below every indicator is the definition, the data source, and the footnote. This is interpretive information, so you know exactly what you're looking at. And the whole point of the site is to get people to use data to promote child health and well-being, and so we made it easy for you to use and share. So if this was exactly what I was looking for, I could grab the URL, I could print exactly what I'm viewing, I could copy this table into Word or PowerPoint, and I can also download these data for my purposes. Now, if this isn't exactly what I was looking for, say I wanted a map for a report that I'm writing, I could just click the title or this Customize Table button, and this will take me to the indicator page where you can customize more fully. So remember, the Data by Region section is where you'll find all of the data for your region only, but the Data by Topic section has all of the data for all regions. You can choose to include your region of interest here and add others if you wish. This is also the section where you can change the type of visualization, years, and data type, and also have access to contextual information, which I'll point out. So now we're in the Data by Topic section. See, we've switched tabs now. This takes you to a table that you were viewing with Assembly District 25 data showing. So all of the regions for which data are available are listed in the left-hand side. And you can change the regions by just clicking on the ones you want to show. Say you wanted to include California in that as well. You can also change the years and characteristics, data types, in order to display exactly what you'd like by clicking in this header. Now again, below the visualization there are definitions, notes, data source, and any additional information about the data you're viewing. And I mentioned before, this is where you can explore the contextual information that'll make it easier to understand the data. So we provide information on the measures, links to other data related to this data on kidsdata.org. We have narratives with information about why this topic is important, what the data at a broad level are saying, policy implications written by policy experts, and research and links to other organizations and seminal research in the field. So I originally wanted to see my district in relation to other districts on this map, so I would hit this Map tab. Now it's already showing assembly districts on the map, but if I wanted to change the overlay, I would just hit this drop-down box and change what I was looking at. Now I could hover over these individual regions and the data will pop up. Or if you're having a difficult time orienting yourself on the map, you can click on the region from the region selector box here, and it'll zoom in and center with your data called out. So it looks like 31.8% of children ages 3 through 5 were not enrolled in preschool or kindergarten in Assembly District 25 according to these years. Now, this is a really much more impactful visualization, in my opinion, than the table. So if this is what I'm really interested in sending along or putting in my report, again, I can grab this URL, I can print this page, and it will come with all of the narrative information below. I have a few additional options here. I can copy this word into Word or PowerPoint. I can download the data as before. I can also get a print-friendly 2-page overview of the topic that's formatted for easy handouts, and I can also include this graphic into the PDF. I can also embed this table or graph into my website or blog, and it has all the functionality of kids data, and it updates automatically when the data are updated. Additionally, I can share, tweet, or email this, and if I put my email address here, I can get an email every time this indicator is updated, so I don't have to continually check back. So what if the data I'm interested in is not cut by legislative district? Since only a small percentage of data are cut by legislative district boundaries, we provide legislative map overlays. And because the data are not actually cut by legislative district and legislative districts don't match county or region boundaries, these just allow users to get a sense of the situation in this district. So let me show you how they work. Say I'm interested in the percentage of kindergartners with personal belief exemptions in my legislative district. In the search bar, I could search for immunizations. And I see that I can view kindergartners with immunization exemptions, but I can tell from the title that it's not cut by legislative district boundaries. It would say that otherwise. But that's okay. I can use a map overlay. I would click on the indicator and then go directly to map. I would click on this map header right here and to ask it to show legislative boundaries. At any point on the Data by Region section and here on any overlay, you're able to ask what my district is if you're unsure, and this will take you to the various sites that will help you figure out exactly in what district you are living. So the legislative boundaries, you're able to select a type of boundary and then select the district. So to follow the line of questioning on Assembly District 25, I would select that here and click Submit. And there's the boundary overlaid on the map in black. If I wanted to see the surrounding or affected counties, I could also click those and you can see that in yellow. Now I have the full range of extraction options from here, so I can easily share this information with my local legislator or policymaker using the tools I mentioned before, including the URL, downloading in other tools, print, and the share options below. So in conclusion, we tried to make it easy for people to get the data that you're looking for, create impactful, effective visualizations, understand the issues, and share what you've learned in order to ultimately improve children's lives. So I know this is a little short, but I'd like to make myself available for questions because I know that I wasn't able to show everything with kidsdata.org, and there's so much more to see. So I look forward to answering your questions.
Hi there, this is Barbara again. So we'll take questions now, and Reagan will be happy to kind of take very specific questions about districts that you're interested or regions of the state that you're interested in. The first question is there a way to show only the indicators that I'm interested in for a particular legislative district?
Yes, that is a great question. If you're interested in a particular district, let's continue with the Assembly District 25, I would select that district in the Data by Region section. And let's say I was only interested in child population and the percentage of children not enrolled in preschool or kindergarten. I could create a custom profile by clicking that button right there and select only the indicators in which I'm interested. Clicking Submit there will provide a customized report that then you can extract for your purposes, again, by saving this URL, downloading or copying, and also printing too. Now this is in contrast to seeing all of the data for all of the all of the data that we have in all categories. So you're able to do that as well by clicking here, where viewing data for all categories above. But this create custom profile is really handy if you're only interested in certain indicators.
Great, thank you, Reagan. Okay, so let's see, our second question is, this is from Colette Kudumu. We have data on child care supply and demand down to the zip code level. Would that be useful for your site?
Oh, we would very much like to have that data available. The site that we currently run only goes down to the school district level as its most local level available. So county level data, city level data, we would be definitely able to show, but not at this point zip code level data.
Do you have child care supply data on the site now?
We do. In our data by topic section, so this is where you can see every indicator available on kidsdata.org. You can expand this, and we have, like I said, over 500. If we were just interested in child care data, I would enter using child care and early care and education, which is the topic where all of our child care data live. We have the following indicators, and these are these have been collected using one of those data partnerships that I had mentioned, where the Child Care Resource and Referral Network has been a great partner in giving us the data that that our users are asking for childcare.
Great, thank you. The second question is, can you show more than one legislative district on a California map or an overlay at the same time?
Sure. So let's say we were to enter here of availability of childcare for potential demand. If I wanted to see these data as a map and then provide a legislative boundary over it, I can choose multiple boundaries. I can also check all and show every single boundary if I were so inclined. let's just choose a few and you can see what that might look like. And this option is available for any of the other boundary types as well. So the state Senate districts as well as the U.S. congressional districts, you're able to show the different, as many or as few of those districts. What you're able or not able to do is to show a state assembly district and a state Senate district, for example, on the same map at the same time. But what you could do is create one image where showing what I'm currently showing, and then navigate to the site on another tab, create the image, and then just choose to show a state Senate district if you were so interested.
Thank you. This next question is from Deirdre Sturm, and before I ask it, I'd just like to remind everybody that you can enter a question into the question box on your dashboard or in the chat. We can see your questions both ways, so feel free to enter your questions. There's time for everyone's questions. Deirdre's question is, where is the data that shows numbers of children receiving special education services?
That's a great question. In the data by topic section, you can, it's within demographics of children with special needs. So special education enrollment is a suite of indicators within that topic. You're also able to search in the search bar, and it'll, if you search for special education, it'll take you to links for these data. Just as by way of example, I could dive into special education enrollment by disability. We have these data by number and percentage and the types of disabilities called out, and you can visualize these data in a multitude of different ways. One additional factor is the overall indicator, special education enrollment. Again, at different years, different data types are available, but you're also able to see these down to the school district level. So this is a really nice indicator. One thing I did want to note that I wasn't able to talk about before was that all of the maps go down to the most local levels that we have. So if you are interested in a particular elementary school district enrollment in special education, you're able to actually see that on a map as well. So although it looks overwhelming and you may not know where to dive in to see your local district, you can just choose it from the map here. I'm sorry, from the region selector, and it'll dive in, zoom in, and have your data called out.
Great, thank you. We have a really technical question here from Amy Rose. Is the homeless data on your site based off the HUD or McKinney-Vento definition of homelessness, and do you have data for both?
That is a fantastic question, and in light of some exciting things that we're hoping to, so basically we're excited to update our site in the coming months with data about homeless youth that come from McKinney-Vento Act. And this is going to be more local level data and down to the school district level. It's going to be pretty technical, and I'm very excited about it. It's one of these data partnerships that I had mentioned before. We may also be able to provide these data at a school, at a legislative district level as well, again with another data partnership that I'm thrilled to talk about. So what we have currently on the site is homeless public school students, and this is at the California level only. So you can see that the type of data that we're going to be unveiling in the coming months is going to be much more detailed and more recent than what we have. But this comes from the National Center for Homeless Education, and I believe that it's based on the McKinney-Vento definition, but it is not from the California Department of Education or Office of Homeless Youth. So it is a report that this organization compiles each year. We're going to be, again, getting it more from the source. So I'm thrilled, and please, if you're interested in that data, enter your email here, and we will send you an email as soon as it's up.
Great. Okay, I'm seeing lots of questions come in. These are all great questions. Thank you very much, everyone. Here's a question, a more general question. Is there support for using the data system, which I believe is kids data, for a specific report if needed? So I think our questioner, Marcia Weber-Olson, is asking about what kind of hands-on help we at Kids Data can provide.
Absolutely. So there's a variety of ways that you can ask for help and that we could help you if you're not able to do or find what you're looking for. So you can go to the help section on Kids Data, and you could find tutorial videos here, and these are specific, based on specific actions that you might like to complete. So there's an overview. There's also a tutorial about how to find a data by region and general help. You could also post a data question on our blog. So I mentioned data points. You are able to ask a data question, post a question here, and in addition to us helping you, the community of data users might be able to help you as well. You could also contact us via phone or email. There are just a few people in the office who field these calls, so it's very possible you'll get me, and I am more than happy to answer your specific questions and help you along. It's one of the things I love about my job, is talking with people who are using the site and trying to use data for change, something I'm very passionate about. So feel free to reach out.
Thank you. Our next question comes from David Koenig. Do you have data on Title I or free and reduced lunch program numbers by school? And if so, how can I map within a district?
So to answer your question, we do have free and reduced price school meal data. So free and reduced price school meals, we have eligibility, and we also have by eligibility status. So this would be kids who are eligible for free, or kids who are eligible for reduced price school meals, and those who are not eligible. So depending on what you're interested in, we do have the eligibility information available. Now notice it's eligibility rather than actual utilization, so keep that in mind when you're using these data. But what we don't have is the data at a school level. The most local level we get is the school district, but on the map you are able to look at data by district. So I'm not sure if that would help, but it definitely allows you to map at this local level.
Great, thank you. This question comes from Lorena Lopez. I attempted to look for data for the city of Visalia, and I was looking for how many are enrolled in preschool and the percentage of those people that are those children that are Hispanic. How can I find the specific data?
So those multiple cross-tabulations is what we call them. Those are challenging. So first, let's tackle this first question of Visalia. I happen to know that Visalia is in Tulare County because I have a good friend there. But we'll click on the city there rather than the unified school district that's there. So we're going to go see data all data related to the city of Visalia. So for education and childcare was what you were looking for. That's the percentage of children not enrolled in kindergarten or preschool, and it's not showing up on this list of data that's available. We're seeing high school graduation, high school dropout rates, but we're not seeing that particular set of data that you were looking for. So it doesn't look like we have that. And to tackle the second part of your question of the multiple disaggregation, so of the kids not involved in preschool or kindergarten, how many are Hispanic versus other races? The data that we have and that we pull from the American Community Survey aren't disaggregated in that way. It's possible that it could be analyzed using the data source material. So I would urge you to go to the American Community Survey and see if you're able to pull out the data that you're looking for cut by race ethnicity. So it's possible it exists if you look at the data source, but we don't have it here cut by race ethnicity. And it doesn't look like Visalia was in the data set for that particular indicator either.
Reagan, could you show the children not enrolled in preschool or kindergarten for the county level, which might be helpful to this question?
Absolutely. So we'll look in Tulare County. So county level data, we'll go to education and child care section. So this is, again, a snapshot. It doesn't show all the indicators there. But clicking on this See All link will show all of the indicators. I think there are a lot of indicators in here. It's one of the reasons it's taking a little bit longer to load. Maybe another question while we wait, Barbara?
Sure. Do you have data, this question is from Amy Liu, do you have data on schools receiving grants from the 21st CCLC program on your site? That is a technical question.
Yeah, no, we don't actually have that data available. I'd be interested to get it though, so maybe we can talk about it offline. I'd love to see where I could get that data and also for what use too. I think basically we make decisions on what goes on kids' data based on the level of interest from our audience, and so the more that people ask about a certain data set, the more likely it is that it will be displayed on the site. So I'd love to talk more about that with you.
Great.
And so the data for early care and education, so this children ages 3 through 5 not enrolled in preschool or kindergarten for Tulare County isn't available as a one-year estimate because the Tulare County actually doesn't, so an LNE, whenever you see this on the site, it stands for low number estimate. So in the footnote, we always, or low number event, we always provide why LNE is showing. So in this case, LNE, a low number event, refers to estimates that have been suppressed because the margin of error was greater than 5 percentage points. So we know that the data aren't as reliable as we would like for them to be, and so in those cases, we suppress the figure. this is a one-year estimate. The 3-year estimate, I'm sorry, the 5-year estimate for Tulare County is actually meets that reliability bar, and so we're able to display those data. So it looks like when you're looking at the 2008 to 2012 estimates, that 45.9% of the children in Tulare County, who are ages 3 through 5 were not enrolled in preschool or kindergarten.
Great, thank you. This question is from Mia Orr. Does your website track trends in prescription drug abuse in children and teens? Could I find this data by legislative district?
That's a great question, and I would love to have my hands on data like that. We don't have that data. We do have data related to alcohol, tobacco, and other drug use, and these data, and it's a lot of indicators that we have available. These data come from the California Healthy Kids Survey and are in the process of being updated. So there will be more recent data available, but what we do have that would be the closest would be recreational use of prescription drugs ever, by grade level, and gender, by race, ethnicity, and level of connectedness to school. So these are pretty detailed and specific disaggregations. If I were to hop into this by grade level, just to give you a sense of what the data are saying, I could show you. These are only, this question on this survey is only asked of 9th and 11th graders and those who are attending non-traditional schools. So as you can see, the data are from 2008 to 2010, and again, we are going to be updating these data before too long. So you can see these data in a variety of ways. The by grade level disaggregation doesn't allow you to see the change over time because it was only asked, it was only disaggregated at the grade level for 1 year, but I think that by gender and grade level, no, I think this is a relatively new question, and so it wasn't asked in previous years. So it looks like this is only 1 year set of data available for this. But there are other indicators relating to drug use that do have trend data available.
Great. Here's a kind of a web question. This question is from Amy Rose. Amy is wondering what program Kids Data uses for the map and graphic display. Is it via Google Maps or a third-party program? It is very helpful, and Amy says that they are hoping to create something similar.
Oh, great. Yeah, so we use Google API for our mapping, and as you can tell, it works very well for our purposes. Obviously, there are many other ways and technology that people can use to do mapping, visual mapping. So one would be Esri, another, there are multiple other, software and APIs that you can use. But one of the things that I like doing is actually talking with people about how to set up their own site and seeing if we can support that in any way too, because overall our goal is to get people to use data in their work, and so we support everybody who's trying to do the same thing. And so maybe we can talk after about other specific things that we're doing. Maybe that will help you in setting up your site. So congratulations on moving forward on a really exciting project. I'm happy to help.
Cool. All right, this next question is another question from Deirdre Sturm. She is looking for information on children aged 0 to 3 years old who have autism diagnosis or are receiving early intervention services, perhaps from CCS.
Yes. So we have CCS data available, but we don't have the diagnosis for children who are receiving CCS. So as the other part to that question, we have children who have been diagnosed with autism or being served in special education due to autism, but we don't have that data for children ages 0 to 3. So as I had shown before, the demographics of children with special health care needs, you would look in this by disability section to find the individual, the reasons for being served. But again, it doesn't capture the age group you're looking at. The CCS enrollees is the first indicator in this topic, and I would hop in here. So you're able to see the numbers and the age group of children who are active CCS enrollees, but it doesn't have diagnosis information. I would urge you, though, to hop on to the data source site. They may have more detailed information in this report than what we have on the site here. So I'd urge you to visit the data source on this one.
Great. Let's see. This is another question from David Kennick. Do you have any data that would benefit a school-based physical activity, health, or nutrition program?
Yeah, I would say the best bet would be to explore our education section. So something might be able to be gained by looking at reading proficiency, math proficiency, to see if kids are getting distracted, or those sorts of academic indicators. But your best bet would be to look in the physical health section. So we do have information on nutrition. So although these are not at a school district level, we do have information on children drinking sugared sweetened beverages by age, by race and ethnicity. We also have eating fast food, eating fruits or vegetables. Again, those are at the county level, but we also have students who ate breakfast in the past day by grade level, by gender or grade level, and also by race ethnicity. And so these, again, come from the California Healthy Kids Survey. They're a little old. They will be updated at some point in the near future. And these could give you a starting place as to where kids are, whether or not kids are reporting that they ate breakfast in the past day. Other indicators you might like to explore would be physical fitness from the FitnessGram and our weight indicators. So these are overweight and obese students by city, by county, and also by grade level. And from the FitnessGram, students who are at a healthy weight or underweight, and we also have this by gender and grade level and race, ethnicity, and grade level down to the school district level.
Great, thank you. So I don't see any more questions at this time. If anybody has any more questions, please type them into the question box or the chat box, and I'm just taking a quick look here. If not, Reagan, I was wondering if you could tell people how to get data alerts that are customized for their interests, and how to keep in touch with us or sign up for our emails.
Absolutely. So if you're interested in learning more about and getting updates on what we're doing, you can always click this email updates button, and this will take you to the e-alert sign up. So if you're interested on learning when a particular data set is updated, you can put your email into the box below that particular indicator. It'll indicate that in fact you want that one. It'll take you to the same place, but it'll have it be customized for the ones that it knows you're interested in. This is where you can pop in and say across the site what type of information I'm interested in. So I could choose topics that I'm interested in. I could choose regions, demographic groups, which is something that we didn't explore today, but I do want to make clear that we have data. All of the data are organized for easy access. So if you're just interested in infants, you're able to explore the data by demographic group section and just look at infant data. But this is where you would choose to say, I am only interested in infants. Please tell me when new data are available about my demographic group. And you would send your, put your email address here. You can include kids data advisory newsletters. So this is where you can put yourself on our list of bi-weekly newsletters where we describe trends that we're seeing in interesting data, new things that we're making available, different functionalities of kids data, and basically to help you stay abreast of everything that's going on kidsdata.org. You can manage your e-alerts here, so it recognizes who you are when you come back. If you want to tailor them more fully, you're able to do that as well. And just easily stay abreast of kidsdata.org.
Great. And I'd just like to point out for people who just want to get our biweekly advisories, which come on a number of data sources, if you have wide-ranging interests relating to children, you can just put your email address into that box under Step 2 and just get our newsletter and then tailor your data interests later by going to Manage Your e-alerts page. Yep. So I think, there's one last question, which is this being recorded? So yes, I would like to remind you all that it is being recorded. We will be posting a recording of this webinar on our site, and we will send you an email when that's up and ready. And then we have one more question. Who would we send suggested resources and data links to enhance your website? What a great question. Thank you, Colette, for asking that question. Reagan?
And you would send it to the Contact Us link. So in Help, you can contact us and send it to kidsdata@lpfch.org. And what happens then is I take a look at the resources and make sure that they're appropriate for the site, and then they are entered into our research and links section. So just as an example, I'm going to dive into just any indicator, go down to the bottom, and they might go into the websites with related information, key report sections, which are continually updated, and also county and regional reports, which we like to call out and support local regional efforts that relate to individual topics. So I'd love to receive those.
Great, thank you. If we have no other questions, I think we'll wrap up the webinar a bit early. We'll be sending you an email with the link to the blog post that Reagan showed you earlier in the webinar with all of our data that is cut by legislative district, so you'll have that for ready reference. And also an extremely short 5-question evaluation to help us make our webinars in the future even better. So I'd like to thank you all for participating. I'd like to thank Reagan. And with that, I'm going to end the webinar and we'll be in touch. We hope that you'll stay in touch with us through Facebook or Twitter or by signing up for our e-alerts and newsletter. Thank you so much, and thank you for joining us today.